Hey, Dr. Keith Currie here. As a board certified chiropractic internist and certified nutritional pathology and functional medicine practitioner, I work with a lot of patients who have type 2 diabetes, helping them improve their health and their quality of life. I also work with many patients who have spinal related pain, neck pain, low back pain caused by degenerative disc disease. So, this segment that I'm going to do today is going to be a unique segment because I'm actually going to couple both sides of my practice, the functional medicine side of my practice with the spine care side of my practice, because type 2 diabetes can cause spine related symptoms or complaints or health problems. The big thing here is that diabetes causes systemic vasculitis. So that causes inflammation of every blood vessel from head to toe. All of the blood vessels from in the entire body are inflamed when someone has type 2 diabetes. So when we talk specifically about spinal discs and the cartilage component that goes along with type 2 diabetes, the diabetes breaks the cartilages and soft tissues down. And so I'm going to show a model here. This model is bone, disc, bone. So these bones, those are the vertebra, okay? And the disc is the soft cartilaginous cushion that goes between the bones. Now, as time, well, let's start here, actually. When you look from the top of it, okay, you've got the nucleus pulposus portion of the disc, and then you have the annular rings that surround that. Well, with type 2 diabetes, it has been shown that the chondrocytes, which are the cartilage producing cells inside of these rings here, inside the disc that help make those rings stronger, that the chondrocytes can become senescent over time. And when they become senescent, that's like going senile. It's the aging, the dying off process. And so those cells that actually make the cartilage can start to die off. And the question is, well, why is this? Well, ultimately, it's because the cells in our body need fresh blood. Okay, they need oxygen that's carried in the blood to get to those cells in order for them to get the nutrients and the nourishment and also the oxygen that they need to be able to be healthy and survive and to do their jobs. Okay, so whenever we have a disc that's broken down, it's dehydrated, it's desiccated, it's degenerative, then we lose that height that we lose the cushion that should be in that disc. What happens in turn is that these joints get all jammed up and they get inflamed, and then that starts perpetuating the chronic breakdown disease portion of this process. Now, it just so happens that the red spongy bone marrow here that's at the end plate of the vertebra, okay, there's a vertebra above the disc and a vertebra below the disc. And that end plate is where the blood is. That's the soft tissue component. And that's the channel or highway for nutrient exchange so that you get fresh blood that comes in contact with that disc. And that's how the disc gets its hydration. That's how it gets its nutrients. Well, with type 2 diabetes, when we get inflammation of those blood vessels and those blood vessels start to break down, then you can start having what's called end plate hardening or sclerosis, which is also another term for hardening. End plate degenerative changes. That's something that you can see on an MRI report. And when that happens, that tells us that the disc itself here is not able to come in contact with quality amounts of fresh blood to get its nutrition. So then over time, those chondrocytes, the cartilage producing cells, can just start to degrade, start breaking down, and then cause problems in the disc. Well, how it specifically causes problems is when we lose that height, then the nerves get pinched, they get compressed. And that's what causes back pain, neck pain, compressive radicular pains like nerve pains, sciatica, spinal stenosis. Spinal stenosis is thought of as bony, and it can be. There's a bony component, but there's also a soft tissue component where when that disc is coming out into the canal here and it's taking up some of the space, then that is actually a soft tissue component of spinal stenosis. So I would tell you that type 2 diabetes is a big, big deal because they've shown that people can have more fractures if they're a diabetic. They have soft tissue remodeling, soft tissue damaging that's occurring. So then in turn, that can be a direct driver of neck pain, back pain, hip pain, leg pain, neuropathies from the compressed nerves. It goes on and on and on. So, besides the fact that diabetes causes kidney damage, visual changes, amputations, dementia, it's linked to dementia as well. There's a lot of factors there. And also the simple fact that if someone has diabetes, they can do things to help themselves improve their health, decrease their systemic levels of inflammation so that they're not being affected quite the same, or at least at the same rate. And so I hope you enjoyed this. If you did, please give me a thumbs up, subscribe to the channel, like the channel. I appreciate that. Also, share it with other people because people need to know this information. You're welcome to go to my practice's website, drcurrie.com, and learn more about my functional medicine practice. I help a lot of people in that. I have patients from all around the country, and it's quite rewarding to see what can be done naturally to improve people's lives. Hope you have a wonderful day.